Hi guys, this is Elizabeth Quam from Engedi Grove. I got done with a surgery. If you're new to this channel, I had breast implants and I got them taken out. This is a homesteading channel. I'm going to be talking about health and homesteading, but this is part of it. I think that a lot of people in our culture, I think there's a big shift happening in many ways and many directions, but the culture of having these women, it basically encourages women to get breast implants. And even my friend, who I know from my past, she had wonderful breasts, and she just told me that she got breast implants. I'm like, why did you get breast implants? You already had large breasts. Anyway, it's just it's sad. And it's not only sad in a social cultural aspect, but it's sad because these things are toxic to us. They actually have to warn people now getting breast implants that they can cause autoimmune issues, that they can cause this, that, and the other. It's called breast implant illness. Okay, so you might have wondered what these things were. They're actually holding up some drainage tubes. And this is probably just too much information. I have to have these drainage tubes in me that just take out the extra fluid. Okay, where am I going with this? Okay. All right, most of you don't care about that. I don't know what you care about. So leave a comment telling me what you do care about. Okay, so anyway, you might care. So I wanted to share with you something that is dear to me. I am frustrated with the medical field system as it is. They don't teach very much nutrition in our medical schools, although we have always known that severity of illness has always been linked to nutritional deficiencies and nutrition. So the severity of something like COVID, the severity of a certain condition is very linked to nutrition. So that's something that I feel like as we have gotten educated, more educated than ever before, we have learned and surmounted a lot of information, and we have lacked bringing that connection. It seems so weird that we have not explored the nutrition and that connection. Iodine deficiency, boron, even boron in general. We're just now learning about boron and K2, which are two nutrients that are extremely important. K2 is a fat-soluble vitamin. I would say that boron is somewhat, actually, a tiny bit fat-soluble too, because you can find it in fat as well, but is not usually known as a fat-soluble vitamin. And our fat-soluble vitamins are missing in action, and our iodine and boron and that fat-soluble vitamin K2 that helps put the calcium that is in our arteries back into our bones, helps us regulate calcium in our bodies, and also boron helps us regulate calcium in our bodies. And I want us to dive into about calcium and the idea of calcium being a binder of bad stuff in our bodies, and it's a binder. So when we think about functional medicine, we think about binders. Well, we don't think about calcium as being a binder. Sometimes people just are like, oh, calcium, too much calcium. No, it's a dysregulation. We need, of course, calcium. Calcium is very important to us, and I'm going to share some things. I want to turn my kind of anger about the medical system into energy, and that energy spent on helping people grow in their knowledge of our health. One of the most famous of calcium dysfunctions in a plant is blossom end rot. Yes, we have a blossom end rot. And that is caused typically by a calcium deficiency. And so that's just one aspect. And when you have boron in your body and K2, it's helping work. So vitamin D helps us absorb a lot of calcium. K2 helps you put it into your bones and where it should be, but also boron does that as well, and it's regulating the calcium in different ways in our body. And also, I would say that boron is even it would help your K2 in your body as a support. It would help make K2 in your body by supporting liver health is what I would say, because we can make K2 in our bodies by the use of K1, and that comes from leafy greens and vegetables. We can make it in our liver. That's what's said. Some people beg to wonder if we can only make it in our microbes, but I believe our liver is capable of making it too. And that was the primary thought of it being all together, but we're learning that the microbes in your intestines are creating it as well. But the liver is so messed up now. Most of our livers are so dysfunctional now because of our toxin load, and a lot of us have fatty livers and a dysregulation of heavy metals in our body, and a dysregulation of calcium in our body and other nutrients. And I want us to zone in on calcium and calcifications like kidney stones and any kind of calcification. It happens in all sorts of diseases. Here, I'm just going to throw up on the screen some of the diseases that you see it in. First of all, dear to my heart, leukodystrophy. So my daughter was said to be dying of leukodystrophy, a demyelinating genetic disorder of the brain in which there is no cure. Basically, you lose the fat cells around your brain, nerve cells, and then you just die. So this is leukoencephalopathy of calcifications, and all new perspective of rare connective tissue calcifying diseases. There are quite a few different diseases of autoimmune diseases, of which there is an increasing amount of autoimmune diseases, calcifications, breast cancer. Calcifications are sometimes an early sign of breast cancer. We have insomnia with pineal gland calcification, mania and bipolar. As there's this dysregulation of calcium that's going on. Parkinson's disease and the basal ganglia calcifications. Alzheimer's, like it just doesn't, it's like as if everything is basically the same disease. It's just manifesting differently because we have different genetics, different propensities, different environmental factors that are affecting ourselves. So when you take in perspective of leukodystrophy, a lot of them are enzyme deficiencies. And I would like to say that until they prove it wrong, I believe that it could be that all leukodystrophies could be mold related, in the way that if you already have a deficiency of something, because oftentimes they're traveling along like normal growth, and then they decline and they start declining. So they're progressing like normal, and then they start deeply declining. If they don't prove to me that it isn't mold, then you should be questioning your doctor. Is this possibly mold toxicity? I want mycotoxin testing done. I want to eliminate this burden of mycotoxins for my children, because I know that my child already has enzyme deficiency disorders, and I know that mold only makes that enzyme deficiency higher, because mold lowers your enzymes, lowers your protein, it screws up everything. It's genotoxic, idiopathic. There's lots of stuff that it does. It dysregulates metals. It dysregulates your calcium. So we'll zone in on the calcium, this is going to get way too long, but gosh, I'm passionate about it. Okay. I want to listen to what Dr. Berg has
Today
to
I'm going to talk about
say.
the big reason why your arteries are calcifying and potentially turning into bone. Now, since heart disease is the #1 killer worldwide, I think it's important to discuss a nutritional aspect of this problem that gives you something you can do about it. And this video is primarily going to talk about the calcium part of this problem more than cholesterol or other problems with the heart. What are the top warning signs that someone can get with a heart attack? Well, #1, you'd have chest pain, especially if you're exercising or exerting yourself or going through emotional stress. And the chest pain is relieved when you rest. That is a really good indicator that there could be a heart problem. And then we have referred pain to your left shoulder or arm, okay, or even your back or the jaw or this side of your head. Since the heart is slightly on the left side, it can refer to that area right here. All right, #3, heartburn without really having heartburn, okay? So you could have just a burning feeling in your chest that has nothing to do with acid. #4, shortness of breath, especially exercise or climbing stairs. And #5, there is no symptoms. You just drop dead of a heart attack. Now, the big problem with calcium is the hardening of the arteries. And now we lose the elasticity. We don't have the ability to adapt to stress, blood pressure, etc. It just becomes hardened, and that puts a huge stress on the entire body. Now, what's interesting about calcium in the arteries is it's not passive. You just don't end up with calcium in the arteries for no reason. It's an active thing that occurs in certain conditions. Now, as far as the type of calcium in the arteries, they are finding that it's the same type of calcium that is in your bone, hydroxyapatite. In fact, this type of calcium makes up 70% of the calcium in your bone. And the vascular system is the second most calcified tissue in the body, excluding your bones. Okay. Now, we do know as people age, their body starts to calcify. Okay. So they start having calcium deposits in their joints, of course, in the arteries, in their eyes, in their tissues, all over. And so this video that you're watching is a very important video to understand the mechanism and what you can do about it. But we do want to keep the bones calcified, and we want to keep the other tissues not calcified. Now, like I've already mentioned, we don't want our arteries becoming bone. And a really good test to do to determine if you have calcium in your arteries is a CAC score. It stands for coronary artery calcification score. Okay. I had it done. You want the results to be 0, no calcium in the arteries. That puts you at a very, very low risk of heart attacks and mortality. So the CAC test is not only one of the best predictors of whether or not you're going to have a heart attack, it's also a really good predictor for mortality in general, because calcification in your tissues is a pathological sign that there's something seriously wrong with your health. Now, the other point I want to bring up is the majority of people over 6 years old have some type of calcium building up in the arteries, which again, like I said, it should not be there. Now, I want to cover something about bone tissue. In your bones, you have 2 types of cells. You have the osteoblast, and then you have the osteoclast. And the osteoblasts are the bone cells that are building bone, okay? They're building bone up and they're creating bone. And then we have the osteoclast, which actually degrades or breaks down bone. So we have these 2 things happening in the bone at all times, right? So if you have too much of this, you get osteoporosis. And then if you have too much of this in your arteries, especially, you start getting calcification in your bones. Your arteries actually are turning into bone, which is it's just bizarre. And if we're talking about inside your arteries, we're talking about the endothelium, which is the inner tissue of your arteries. There's actually stem cells, okay, in this layer of your artery that are osteogenic. What does that mean, osteogenic? It means that they're capable of producing bone. And so a stem cell is an undifferentiated cell. It's kind of like a blank slate that has the potential to turn into a certain cell, depending on what the body needs. So when someone starts developing bone tissue in their arteries, that is a big problem in the differentiation of what the stem cell should turn into. Now, if we take a look at autoimmune diseases, we have the same problem. We have a differentiation problem. Your immune system is unable to differentiate between a normal cell and a pathogen. It ends up attacking your own cells. And so with this problem, it's very similar. It's a differentiation problem. Well, guess what? Vitamin K2 is a vitamin that was recently discovered. Now, when I say discovered, I mean that it's been there all this time. We just did not recognize it. And vitamin K2 is involved in this differentiation problem. If you have sufficient vitamin K2 in your body, you're going to inhibit this calcification problem. You're going to inhibit the osteoblast, the cell that forms bone in the wrong place. So vitamin K2 is a potent stimulator of a certain protein called matrix GLA protein. And this protein inhibits vascular mineralization and is dependent on K2. So if you don't have K2, this protein is not going to inhibit vascular mineralization or calcification. Vitamin K2 is becoming more and more popular. There's over 3,500 research papers on vitamin K2 that you can look up. And so vitamin K2 is all about keeping calcium out of the arteries and keeping calcium in the bone and making your bones very, very strong. Now, I believe that the majority of the population is deficient in vitamin K2, at least subclinically, okay? And I'm going to tell you why in the next section. All right, why are we deficient in vitamin K2? Well, what's interesting about K2, it's made by bacteria, okay? It's different than vitamin K1, which actually comes from leafy greens. And so vitamin K2 is made by bacteria. In fact, even in your gut, you can convert vitamin K1 to K2, okay, if you have the right microbes. So if you have gut problems, okay, and you don't have the right microbes, you can't make this conversion. That's number one. Also, as far as an absorption problem, vitamin K2 is a fat-soluble vitamin, which means it's dependent on bile, okay, which is produced by the liver. And if your liver is fatty, which you can pretty much tell if you have a fatty liver if you have a belly, okay? If you have belly fat, you have a fatty liver. The more damage to the liver, the less bile you're going to make and the less K2 you're going to absorb. If you don't have a gallbladder, if you have a congested gallbladder, if you have gallbladder problems, if you have a bile deficiency, you will also have a problem absorbing vitamin K2. If you have inflammation in your gut, if you have gastric bypass surgery or some type of problem with your gut, that can inhibit your absorption of K2. Also, if you don't have enough fermented foods, you could be deficient in K2 because certain microbes in the fermentation process can actually make vitamin K2. So let me give you some examples. We have natto, which is a fermented soybeans. I think it's very popular in the East, not in the West. Sauerkraut has K2. Okay, you know what that is. Cheese is a fermented product. Raw cheese, especially if it's hard cheeses or soft cheeses from Europe, because usually they have raw milk cheese, you're going to have a good amount of vitamin K2. If you actually can get raw butter, okay, and grass-fed butter, you'll have a good amount of vitamin K2. And guess what? Butter is a fermented product, okay? And then, of course, we have kefir, which is one level above yogurt. If that's made from grass-fed animals, you're going to have a good amount of K2. And of course, if you're getting conventional yogurt or conventional kefir that is pasteurized and sweetened, you're probably not going to get very much K2. Now, vitamin K2 is also in egg yolks. It's also in beef liver, especially if it's grass-fed. It's in sausage. It's basically in fatty foods. So if you're on a low-fat diet, okay, you might be omitting these right here. And what's really bizarre to me is take a wild guess what mainstream recommends for cardiovascular disease. Okay, if you guessed a low-fat diet, you are correct. What do they recommend? They recommend fruits, vegetables, grains, at least half whole grains and half refined grains, and they even allow a good amount of added sugars to that diet. And so this is just another one of those examples of finding out what they are telling you to do or what mainstream is telling you to do and do the complete opposite. I mean, even take a look at statin drugs, right? Statin drugs inhibit vitamin K2. And I'll put a research paper down below to back that up. Now, as far as the type of vitamin K2, there's a lot of different types. One type in these foods right here is MK4. But if you get MK4 in a supplement, they make it synthetically. I recommend the natural form of vitamin K2, which is MK7. And I also recommend taking it with vitamin D, okay? Now, as far as the ratios go, if you're taking 10,000 IUs of vitamin D3, you would take 100 micrograms of vitamin K2. One last point about vitamin D that's actually quite interesting. Some people are concerned about the toxicity levels of vitamin D3, right? Well, really the only side effect from taking very large amounts of vitamin D3, I'm talking like several 100,000 IUs of vitamin D3 over a month, okay? The only major complication is hypercalcemia. That means too much calcium in the blood. Well, guess what vitamin K2 does? It helps to keep the calcium out of the arteries and in the bone. That's why I recommend taking them together. And on that note, I think you might find it interesting in this next video on vitamin D toxicity. Check it out.
Okay, thank you for going through that. Now, here is my bit. I want to show you this piece about how I believe that calcium in our bodies is running around and it is calcifying microbes and pathogens in our body. I believe that it's calcifying and trying to keep our bodies away from the harm that some of these microbes are doing in our body where they're not supposed to be. Now that's me. You know, a lot of times I'm telling you what people are saying or what studies find, but that is me saying this. I believe that it is that the binding is happening and that is happening around a pathogen to take it out, or a mycotoxin, a mold toxin. Mycotoxins are mold toxins. Antibiotics. When you're taking a calcium supplement, there are some antibiotics that do not and are not as effective. Some medications, a lot of medications are mycotoxins or mycotoxin-like. If you're taking calcium, oftentimes they'll might say, don't take the calcium supplement because it may reduce the effectiveness of this antibiotic or this medication because it is binding it and taking it out of the body. Now, sometimes that binding power accumulates on something, or it doesn't get out of your kidney, and then you have some kidney stones. And this is me, but I want to show you a case of how this woman, to keep her body safe, her body calcified a baby, a dead baby inside of her. And I want us to, that is really sad, but it is an example, a big example, because I remember going to a human museum one time and seeing a calcified baby. And I found a video online that was actually talking about this woman's experience of having a calcification in her. And it was a calcified baby, and she had it, and she carried it for a long time. But that the body basically took that pathogen, it became a pathogen. It became an area where it could cause her harm because it wasn't getting out of her body, and it calcified. And I kind of wonder if she had enough nutrients to take it out, to get it out, if it would have kept its calcification in there or not. And that is a major case. Like, that's an extreme example, but let's look at it.
Baby. When Huang Yijun was 31 in 1948, she became pregnant. While there's nothing particularly remarkable about a random human woman becoming pregnant, Yijun's case was quite unique from start to finish, as you'll soon hear. For starters, shortly after Yijun became pregnant, she found out that she had an ectopic pregnancy, meaning the egg had not attached in the uterus. In most ectopic pregnancies, the egg will implant in the fallopian tubes, but in Huang's case, the egg implanted just outside her fallopian tubes, causing what is known as an abdominal pregnancy. These are very rare, with only about 1% of all ectopic pregnancies falling into this category, about 0.0001% of all pregnancies. In abdominal pregnancies, the embryo often attaches to organs inside the abdomen, and can even attach to such things as a woman's liver, diaphragm, bowels, or spleen. Surprisingly, an abdominal pregnancy is not necessarily a death sentence for the growing baby, though there are significant risks to the mother and baby, and the few such babies who do end up surviving have a 21% chance of having birth defects, in part due to lack of amniotic fluid buffer and more compression than the baby would otherwise experience in the uterus. In Huang's case, the baby did not survive. If the baby dies when it is small enough, the tissues will typically break down and the body will get rid of it naturally. In Huang's case, though, the baby was large enough that her body was unable to do this. The doctors told her this would be the case, and they recommended she get it removed to avoid any potential health problems from it down the line. Unfortunately, the charge for the surgery, converted to US dollars, would have been about $150, or approximately $1,500 today. As Huang said, "It was a huge sum at the time, more than the whole family earned in several years, so I did nothing and ignored it." In cases where the baby is too large for the body to get rid of it, instead calcium deposits will build up around the dead tissue, turning the fetus into a so-called stone baby, or more technically, a lithopedion. Women who have this happen are often unaware of it. In known cases of stone babies, the average time span of carrying the fetus is about 22 years because of this. The woman can even have other children despite the presence of the stone baby.
So that is one extreme example. I believe that microbes are good for us when they're in our large intestine. I don't know, but I beg to wonder and beg to argue that they're not supposed to be running around our brain, running around our blood vessels. We used to think that it was sterile, and now all of a sudden we're like discovering microbes everywhere. But I don't think we're a healthy cohort of people to be analyzing whether it is normal or not to have microbes running around all of our body inside of us. And so, in short, I would just like to say, increasing your fat-soluble vitamins through sunshine and through boron and iodine supplementation, Lugos, iodines, and boron, K2, all your fat-soluble vitamins, eating real food, and increasing your diversity in food you eat. All those things are going to be helpful. And when you're gardening, you can investigate supplementing your ground with iodine and boron and trying to increase the microbes. I've recently been turned on to learn about charcoal because I'm going to be amending my soil that's a lot of clay. And so I also have heard that the microbe diversity is wonderful, and the charcoal can promote that microbiome diversity as well as detoxification and just water retention and everything. So I'll be doing a video on that, and I hope that you enjoyed this video and absorbed some of it, and I hope that you're not freaking out now, but I hope that I'm turning you on to boron and iodine and fat-soluble vitamins. See you next time.